Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.
Republican Representative Mark Bourne of Beaver Dam is seeking re-election in the 39th Assembly District. The election is November 6th. Mark, welcome back to WisconsinEye.
Thanks for having me back. Good to be here.
Standard question for incumbents. If you're re-elected, top priority or priorities or goals next session?
Oh, I've got a number of things that we've already started working on, looking at doing some reforms to the Chapter 51 statute.
Which is what?
For
Subject.
mental health commitments.
Thank you.
Yeah, and working with a variety of stakeholder groups there in public safety and health, hospitals, as well as interest groups for folks with mental illness and things like that. So it's a kind of a complex issue, but we've started digging into that because we've seen that there are a lot of concerns from different parts of that system of trying to improve the system and make it function better. And so it'll be a long process. I'm not sure if we'll get it done this session or not yet because we're kind of in the early stages of it. DOJ is also interested in working on it, so we're working with them on it too. But it's something that if we can find some compromise and some resolution, we'll move forward as soon as we can. It's just we're not sure yet how long that'll take with these things. And sometimes I've worked on these issues for several sessions if that's what it takes. But that's one that we've been working on this summer a little bit. Okay. And I'm going to continue to work on corrections issues. I'm on both the Juvenile Corrections Study Committee that's was formed now, as well as on the Space Needs Committee for the prison system. Right. So those will be issues I continue to work on. And as a member of Joint Finance, I'm just looking forward to getting back to tackling the next budget and all of the challenges and opportunities that come with working on a state budget.
Let's start with prisons and the budget for this debate over whether we need a new state prison. Waupun and Green Bay built in the 1800s. Mm-hmm. Some Democratic candidates for governor suggested we could cut our prison population in half over several years. Mm-hmm. Representative Steffens leading a charge to keep a new prison in the Green Bay area. Mm-hmm. Do we need a new state prison?
We probably do, but I don't want to get too far ahead of the study committee and the consultant that we've hired to work on that this fall. And so, but I think there's a variety of issues that you brought up. Well, first of all, is there opportunity for prison reform? Sure there is. There's some opportunity for reform to get some folks out probably sooner. Some nonviolent offenders maybe don't need to be there at all. But the idea that the Dems have put forward that they could release half of the population is crazy. You'd be releasing violent offenders. That's very clear in the data. That's just not something that's realistic. But is it realistic to a certain percentage, probably a single-digit percentage of the population, to get them out sooner or not have them in there at all? And would that help our capacity issues? Sure. And those are things that we should continue to work on. We've done some of that in this last budget with more money into like the Windows to Work program, and ORS is another program that focuses on helping folks that are close to release transition better into society and get them out a little bit sooner by earning an earlier release through work programs and things. And so those are good programs that help ease the overcrowding, and we should continue to work on that sort of stuff. As far as whether or not we need a new prison, I think you hit it when you said we've got two prisons that were operating that were built in the 1800s. I think long term, it will be better and safer for staff and inmates alike, as well as better for our budgets to operate in a more effective way with current prisons as opposed to running these old ones and continuing to maintain and the costs associated with that. So I think that's something that will be part of a comprehensive plan that hopefully will come out of the study committee, and then the legislature and the governor and the agency and stuff can work through that over the next, probably several decades. It's not going to be something that's a one budget issue, but how do we address capacity needs, staffing needs, long-term costs of the system, and still maintain a system that we need to have to ensure public safety.
Your caucus put forth a plan to finance highways, bridges, maintenance, and construction long term. You're a member of finance.
Yep.
How do you want the impasse, the gridlock, how would you like the impasse over transportation funding broken?
Well, I think we need to keep putting forward plans like that and keep talking about it is probably a way that you work through it legislative-wise, because I think the more we can discuss ideas, the more likely we are to eventually arrive at a good conclusion. I think from my perspective, we need to find a long-term funding solution. I think it's clear if you look at the studies, if you look at what the think tanks are putting out, long-term the gas tax is not the answer. Cars are becoming both more fuel efficient. Also, the auto industry and other industries like Amazon for their deliveries are looking at things that are not gas powered, but electric cars and drones and things like that. And so these sorts of things are only going to continue to lower gas tax revenue for both federal transportation aid and then how we fund a lot of it in the state. So we're going to have to look at something. I think most of the think tanks put out either you got to do tolling or some sort of mileage fee to really capture a true user fee. So I think we need to look at those type of alternatives, and I think we're going to, at some point, we're going to have to pick one. And as with any change, there's going to be pluses and minuses to those. There's costs with installing and running either one of a type of mileage program or a open road tolling. But if you want to have a true user fee, which I think we need to have, the gas tax was that for a while, but that's kind of the user fee of the past, or at least it's going to be. So let's try to find a true user fee that will support the system, that we can make the investments we need.
You voted for a budget that raised K-12 state aids by more than $600 million. Mm-hmm. When local educators, principals, and superintendents say, thank you very much, we need another big increase next budget, what's your answer?
Well, I think we'll continue to make significant investments in K through 12 education. I've had an opportunity to vote for 3 budgets. All of them had more money into K through 12. This one had the most, and I think that was a good investment. And I think we'll continue to do that, but not just overall investment. I think there's areas that we should focus on too. Like this time we focused on some of the lower spending districts and trying to help them move up. This time we also invested in the high cost special education. And that was something that for 2 budgets I've been trying to work on with Senator Olson. We were glad to finally get that into this budget. And I think the next budget needs to focus more on the cost of special education. We were able to help the high cost ones, but that's a small percentage. I think we should focus more investment into special education in general. I've been advocating for that in my time in the legislature. We just haven't been able to accomplish it yet. So I'll continue to work on that, and I'm hearing others talk about that, which I think is a good thing. And so, yeah, there'll be more investment in education, some of it targeted like the special education stuff. And I think that's all something that's essential for our future. It's part of how we, not just create opportunities for our kids and our young people, but it's how we build our workforce, the next generation of leaders and workers, and that's going to drive our Wisconsin economy and continue to make Wisconsin great.
Tony Evers wants $600 million more just for special ed. Can the state budget afford that?
Well, I don't know, because we're not in the state budget process yet, and that's the thing, and that's why I've talked some about all of the promises that these candidates make on the campaign trail. I'm certainly not going to put a number on it. I will say I'm committed to continuing to work as I have the last couple cycles to fund special education at a higher level, but we got to look at it as a comprehensive budget and how much we can afford to invest in all of our priorities, and education is certainly, if not the top, one of the top ones, and then we'll get, I'm sure, investment. But to put a number on it at this point, I just don't think that's responsible.
The choice, the voucher program, has been expanded. Are you happy where it is, or you do want to expand it further by even making more families able to participate?
I like the modest growth it's had now. I mean, I think when I looked at some of the spending over the last couple of budgets, it's still a very small part of the K through 12 budget, and as it should be and will be, but it creates that opportunity for low-income families to make the best choice for their kids and their families, just as other folks that can afford to do it are able to do. And so that's why I've always supported the low-income side of it, and I like that there's those limits in place, and that it's basically gone from just under 1% of the K through 12 budget to now just 1.1%, so just over. So the growth has been modest in the big picture of the several $billion that we invest into education, and so I like that it's been a modest growth, but there for families and low-income families to be able to make the best choice for their family.
UW system budget, the governor wants to continue for a 7th and 8th year the freeze on resident undergrad tuition. Do you agree with that?
Yeah, I think that's likely to continue. President Cross and the UW system Board of Regents also just put out their budget request, and they included a freeze in the next year. And so I think that that's kind of the consensus, that that's something that can be managed with the other revenue streams and things. And I think that the budget that was put out by the UW system was a reasonable one. And I told President Cross that when I met with him a couple of weeks ago, that certainly if we continue to see the successful economic growth that we're seeing in the state right now, and we continue to see revenues increasing, I think that's a budget that I can get behind. Obviously, I'm not making a dollar promise on that, just like on anything else we've talked about. But with the growth we're seeing, I think it was a really reasonable request.
Levy limits on local governments have limited property taxes for 13, 14 years.
Mm-hmm.
Some local government leaders say this hurts our ability to provide local services.
Sure.
Keep levy limits, loosen them, get rid of them?
I think we have to keep levy limits because property taxes are still too high and a real hardship, especially for retired folks and some of our families in Wisconsin. I would rather approach, and I've talked with the League of Municipalities and local officials and the counties and stuff about this, approach their financial concerns in different ways. I think the last 2 budgets now I've sponsored and got put into the budget motions from the League of Municipalities to allow some exemptions to those limits, and that were reasonable exemptions, that were things that were beneficial, where communities are working together, and for public safety was the last one, for fire, water protection. And so those were things that were reasonable things, that were good exemptions, that relieve some of that pressure on the local governments. So I'd like to work on more things like that. I'd also be open to looking to, if we can afford to do so, to increasing aids to local governments, shared revenue. I know the governor in the last couple of days talked about increasing county transportation aid. I'm in support of that, as long as we can afford it in the big budget picture. So again, I'm not putting a number on it, but if we can increase those type of things, I think those are good, sound investments. And I'd like to see that, but I don't want to see property taxes go up.
Let's talk about health care. Thoughts on how we protect and expand health care in rural Wisconsin?
I think that there's a number of things. I think economic development and jobs in those areas that will bring people to those communities will help with that. I think we can do more working with our medical schools. We have a fair amount of that going on already with expanding residency programs. The state has funded those more in the last couple of budgets to help get more residency programs out throughout the state, out of our 2 medical schools. Medical College expanding their programs into Green Bay and Wausau, I think it was, in the last few years to get more students out into other parts of the state. I think I'm open to incentivizing some of that. I brought forward a proposal that didn't move in this budget from one of the physician groups to do a little bit more to incentivize doctors and clinics throughout Wisconsin to bring in, I think they called it preceptors, the students that were doing their residency work in clinics, to try to expand more of that, try to incentivize more folks to get involved in that in different parts of the state, because a lot of the studies show if you do some of your work and training in some of those areas, you're more likely to work or stay there. And so I'm open to continuing to work with medical providers and our schools to do that. I mean, ultimately the state can't force someone to work somewhere, but we can be partners with hospitals and clinics and the folks that are educating them. Another one is the UW system. We've put more money into expanding nursing programs at some of the UW schools to try to train more people to be advanced in the nursing field and do some of that relief in those clinics then that you see from the nurse practitioners and things like that to help out doctors and clinics.
As a member of finance, you've heard from hospitals and other medical providers about our MA reimbursement rates.
Mm-hmm.
And they say they're too low. Are we at a tipping point with those MA reimbursement rates?
I don't know if we're at a tipping point, but they are too low, and we increased them this budget. And I think if, again, continued economic success like we've been enjoying in Wisconsin here the last couple of years will hopefully allow us to have revenue surpluses that will allow us to invest more in that, because that's another area I think both in Medicaid reimbursements for hospitals and medical, but also dental's another one, that we should continue to focus on investing in those areas.
So that pilot program, State and Delta Dental, that provides dental care to low income in some of these regional clinics, that should stay a priority?
Yeah, I mean, I want to see what the results have been, but I'm guessing they're going to be positive, and that's why I supported the program in the first place, and I'm hopeful that we can continue to build on. There's a lot of things that we've invested in the last few budgets. That's a good example. Some of the regional treatment clinics for opioids and stuff. I want to see what the results are. We've got 2 new mental health programs in schools just put into this budget. I want to see what some of those results are so we can decide what's working and where we can invest more money in all those areas.
Have you been lobbied by AARP on the issue of caregivers? AARP estimates that 578,000 Wisconsin residents provide care for a family member or a neighbor. Would you support laws or rules that require hospitals to recognize and work with family caregivers when a loved one is hospitalized?
I saw that in their legislative agenda, I think, that they sent to me,
Right.
among like a dozen things, and I thought it was interesting. I don't really have a position on it at this point. I think we need to do more discussion about it, because I'm not so sure that there aren't things in place already that would allow for some of that to occur, like medical power of attorney. And, in my experience working with some of my family members, helping my grandma through some of this stuff, the medical providers aren't unwilling to communicate with me as long as she says that's something she wants. So I'm not sure that we need legislation on it. So I think I need to talk to both AARP about why they're bringing that forward, what they're hearing in the field, and then other providers and things to see if a law is really necessary or if there are other ways to address that. But it's certainly something that families are working on. Like I said, I've been helping my grandma with some of her medical stuff, and so it's something that we need to look at.
Position on legalizing recreational and medical marijuana?
Definitely not in support of legalizing recreational marijuana. I think that there are concerns about public safety with, adding another level of OWI by legalizing something else that can cause that sort of driving. I think also a lot of the folks I've worked with on the opioid crisis, counselors and stuff, are concerned that it's a gateway drug. And so I wouldn't support that, but I'm open to medical. I think that it's something that, that can be helpful and that can be regulated in a prescription way, that it's not abused. And I think that some of my colleagues I've been talking to are working on legislation for this next session, and I've been told them I'm interested in it also. Final question, the differences between you and your opponent on November 6th? Well, I don't really know a lot about my opponent. I've seen her at a few events. I've only heard her speak, I think, once. She seems to be mostly talking about just the normal Dem issues. So I focus more on, what I've been able to accomplish. And I promised when I ran back in 2012, the first time, to take the common sense conservative values of the district to Madison. I think that's exactly what I've done. Is we've reformed government, we've cut taxes, but we've still invested in our priorities. We've seen the economic success we're having right now. I think we should just continue building on that, and I'm hopeful that the voters of the 39th will feel the same way. Republican Representative Mark Bourne of Beaver Dam is seeking re-election in the 39th Assembly District. The election is November 6th. Mark, thanks for talking to WisconsinEye. Thanks for having me. Thank you.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.